medicine, confusion costs marks, and mistakes cost lives. Stop memorizing, start understanding. This is Dr. ABM, where medicine finally makes sense. And today we'll be looking at the blood supply, the venous drainage of the upper limb. Now, the upper limb contains or consists of very significant and important blood vessels or vascular network that's designed primarily to maintain perfusion. Now we'll start with the arterial supply of the upper limb. The arterial supply of the upper limb is a direct continuation of the subclavian system. So the first you have is the subclavian artery. Now the subclavian artery originates differently from the right and from the left. From the left, it originates directly from the arc of the aorta, the aortic arch, but from the right, it originates from the brachiocephalic trunk. Now the subclavian artery will carry blood, oxygenated blood, on the right side from the brachiocephalic trunk, on the left side from the aortic arch, and we continue till it forms the axillary artery at the border of the first rib. Then the axillary artery, which begins from the lateral border of the first rib, will continue to form the brachial artery at around the inferior border of the teres major. But this axillary artery is divided into three parts by the pectoralis minor. Each part has branches according to the number of the parts. So the first part has one branch, second part has two branches, and the third part has three branches. The first part has the superior thoracic branch, the second part has thoracoacromial and lateral thoracic branch, the third part has subscapular branch, anterior circumflex humeral branch, and posterior circumflex humeral branch. Now the clinical importance of the axilla or axillary artery is it serves as a surgical landmark. Alright, so the axillary artery will continue to become the brachial artery at the teres major, just around in the cubital fossa around the neck of the radius. Now the branches of the brachial artery are the profunda brachii, the nutrient artery to the humerus, the superior and inferior ulnar collateral arteries. The brachial artery will terminate and divide into two parts. It terminates to form the radial artery and the ulnar artery. So at this portion, it divides into two. First radial and second the ulnar. Now the brachial artery is important in blood pressure measurement, and it can easily be affected in the supracondylar fracture. Now radial artery is found in the lateral aspect of the forearm. It passes through the anatomical snuff box and enters into the palm. It forms the deep palmar arch. The branches of the radial artery are the radial recurrent artery or branch, superficial palmar branch, and the dorsal carpal branch. The ulnar artery is at the medial part of the forearm. The branches are the anterior and posterior ulnar recurrent artery or branch and the common interosseous branch. It is the ulnar artery that forms the superficial palmar arch. Remember, radial artery forms deep, ulnar artery forms superficial palmar arch. Now the palmar arches, superficial palmar arches from the ulnar artery supplies the digits. So it forms the common digit arteries, while the deep palmar arch, which is mainly from the radial artery, supplies the palmar metacarpal arteries. And these arteries or these arches are important for collateral circulation of blood. They are found in the hand for collateral circulation. Very, very important. Now, talking about the venous drainage, the drainage of the upper limb or the veins that drain the upper limb are divided into superficial and deep veins. The superficial veins, which are very important, are the cephalic vein, the basilic vein, and the median cubital vein. So this is the cephalic vein, which is lateral and drains into the axillary vein. Before the axillary vein drains into the subclavian vein, the basilic vein is medial. It also joins the brachial veins. While the medial cubital vein, here usually in the cubital fossa, connects the cephalic and the basilic vein and is the site for venipuncture. The deep veins, we call them accompanying veins. They accompany arteries. They follow the artery. So just like you have radial artery, there's a radial vein. Ulnar artery, there's an ulnar vein, and there's a brachial vein. Now the clinical correlates of veins is in venipuncture in the medial cubital vein and axillary vein thrombosis compartment syndrome. Very important.